Up to 85% of women will have a tear during childbirth. Why isn't local anaesthetic put in as standard when the mum, the woman, the person is pushing, so that way it helps to reduce the pain and discomfort that they have afterwards? So firstly, 15% of all women and people will not have a tear. So you could potentially be injecting into the perineal area, which is uncomfortable and it's painful and it's sore in itself, when it's not needed or necessary. Now, the other thing to factor in with that is local anaesthetic has risks and benefits as well. There is only so much local anaesthetic you can put in because it can increase the chance of local anaesthetic toxicity, which can cause a variety of problems for the woman and the person if they have too much of it. That's why midwives have to use it within certain volumes, so they can't go over certain volumes to prevent local anaesthetic toxicity. And it's also remembering that not all women will need repair of their tear either. So whilst I say yes, 85% of women will tear during childbirth, some of those are skin tears, some of them are first degree tears that don't need any stitches at all. Some of them might be just labia tears or grazes, for example, so the skin has come apart, but again, it will heal on its own terms, so you don't necessarily need the stitches in those terms. It might sting a little bit when you weave, and there is also a small body of research that highlights that not all second degree tears need stitching either. Really, it's up to the woman to consent as to whether she's happy for the perineal tear to be repaired. Some women and people will choose not to have it repaired, and that's their choice, weighing up the benefits and risks of doing so. But in those terms, again, you'd be putting local anaesthetic in and potentially causing more problems for the people who haven't had a tear, the people who don't need suturing and don't need stitching of the tear. And when tears can go anywhere in the vagina and the vulva, for example, and the perineum, what you would be doing is infiltrating down here in the perineal body. But if you had tears up here, it wouldn't be beneficial to have that local anaesthetic down here and you've torn up here, for example, around the labia. The labia is incredibly sensitive and you don't want to put any needles, any injections in there unless you have to. And women often will say that's the most uncomfortable part, is if you are infiltrating and putting that needle in to repair a labial tear, they will say that's the most uncomfortable. So again, you don't want to do it unless you need it, unless it is required, and only if stitching of that tear is repaired. On a final note, third and fourth degree tears are done in theatre, and that's done with a spinal block so that the woman or person is completely numb from the waist down to be able to repair it effectively. Local anaesthetic would not help in this case.